Hi there. Welcome back to Amize Health, your journey to amazing health. I'm Dr. Thorpe Amize. I'm so glad to have you guys on with me tonight. So this month, I got into this year talking about high blood pressure or hypertension, and part of the reason I decided to do it that way is because really high blood pressure is so prevalent among minority communities that I really wanted to make sure that this is something that we tackle. And by tackle, I mean I wanted us to get an understanding of what our risk factors are, what can we do about them, and I wanted to also talk about what kind of symptoms we can typically get, and what things can we actually do about this, if there's anything we can do. So I'm just going to recap what we talked about over the past 3 weeks, by summarizing each of those things for you. And then from there, what I'm going to do is I want to go ahead and get into what your comments and what your questions are so that we can get all of those answered for you guys. So once again, thank you for joining us on Amize Health. I'm Dr. Thorpe Amize. I'm so happy to have you guys on tonight. And so let's get into it. So when I started talking about risk factors, I talked about some that are modifiable and some that are not modifiable. And so the things that I talked about were the modifiable ones being obesity or increased weight, high salt diet, physical inactivity, meaning not exercising, high alcohol consumption, and then the non-modifiable things that I talked about was age, race, and family history. Those are things that you cannot change. You can't change your age, you can't change your race, you cannot change your family history. But you can still do the things or work on the modifiable risk factors in order to lessen the chances of your blood pressure increasing. So, one major category that I did not discuss when I talked about modifiable risk factors, and I wanted to bring it up tonight, is stress. So, stress can absolutely elevate your blood pressure. And I know that it's easy to say decrease your stress level, especially for many of us that have stressful jobs or you have a stressful family situation. And especially since COVID happened, more and more of us are under more stress than we've ever seen before. So I know that I want to say decrease your stress, and you should, as best as you can. And if you need to seek help to decrease that stress, I thoroughly encourage you to do that. But I do want to say that stress is something that definitely can increase your blood pressure. Stress has been studied in such a way that it's been shown to be involved in many different disease processes. But tonight we're only talking about high blood pressure. Okay. So the things that we can work on is our diet. So decreasing the salt in your diet, increasing your exercising or your physical activity, decreasing the amount of alcohol that you're consuming, and then work on modifying your stress level. If we can do those things, then we absolutely can decrease our blood pressure. So tonight, I have you guys joining me both on YouTube Live and Facebook Live. So I'm trying to go between the two. So you guys bear with me. I'm going to try to get whatever questions you have on both platforms. But should you have any questions that you are unable to post on either of those, if you know me personally, you could send me a message. But if you don't, you can DM me on either of those platforms or on Instagram or TikTok. I'll be checking the messages throughout. Okay, so far we've talked about risk factors. I'm going to move right into symptoms. And I mentioned this in the videos before about people saying, well, I don't have any symptoms, so whatever, the doctor just trying to get me on some medicine. That's why they just want me to take some medicine. I don't have high blood pressure. I don't feel nothing. Well, let me tell you, if you wait for you to start feeling something, your blood pressure is absolutely too high. You do not want to wait until you start to feel symptoms. What you want to do is manage your blood pressure before it gets there. Because if it has gotten to the point where you are symptomatic, oh, some people say, oh, I know my blood pressure is high because I had a headache, or I have headaches when it's high, or I know when it's high because, I just don't feel like myself. Those things are concerning, because the truth is, if your blood pressure is going that high that it is causing you to be symptomatic, it's likely in a range that puts you at a risk for a heart attack or stroke. Now, having a heart attack or a stroke for some people may not think of it as a big deal, but it absolutely is. Because the other things that can happen from a heart attack is then leading to heart failure. What can happen from a stroke? You end up disabled, unable to function, unable to do the job or the work that you're doing to keep your family afloat. So it's not just impacting your health, it impacts your livelihood and impacts the way that you live your life. So I would caution you against saying, oh, I'm waiting to feel something before I do something about it. Now, this goes back to something that I've talked about in previous videos before, which is che- you should be getting regular checkups with your primary care doctor. If you don't have one, I would encourage you to get one, because having the regular visits with your primary care doctor at least once a year, if you do not have any medical issues, is it's going to, one, you get your vitals checked. So if your blood pressure is increasing, they will already have an idea of that. Two, you get lab work done. So if there's anything that is going on that needs to be monitored, they are monitoring it. And so if there are any changes, we catch it early enough to do something about it before it gets to the point, like in this case, a heart attack or stroke or death. We don't like to talk about that one, but that's a possibility, right? Because a severe stroke can cause a fatality, it can cause you to die. It doesn't, a lot of times when we think about strokes, we think about the disability part of it. We think about the inability to use either our arm or leg, or the inability to speak the same way, the facial drooping, those kind of things that can happen. But we have to think about it too, that a massive stroke can actually kill you. So we do not want to get to the point where your blood pressure is so high that those are the kinds of things that can happen. And I know that that's not what some of you want to hear, but that is the reality of your blood pressure going high. Now, some people will come into the office and their blood pressure is elevated and they started having chest pain and now they're freaking out. Like, this is one of the worst things that can happen. And they were told before to modify their diet. They got the opportunity to modify their diet, they didn't do that. They got prescribed medication, they didn't take it, and now we're here at the point of, okay, I'm having chest pain, what's going on? So we don't want to get there. We're trying to avoid ever getting there. So what we can do is the next set of things that I'm going to talk about, the behaviors that we can modify in order to get our blood pressure or keep our blood pressure under control. Now, earlier I mentioned that there are modifiable risk factors and there's some that are not modifiable. So for some people, a subset of the population, unfortunately, even when you do all the things that I'm talking about, that I'm going to mention doing, even when you do that, for some people they will still have high blood pressure. And for those individuals, you need to take the medication that you are prescribed. No ifs, ands, or buts about it. You definitely need the medication that you are prescribed. The way that I deal with my patients when I see them is this: I give the opportunity. I say, if you come in, if your blood pressure is not severely elevated, so meaning it's 140s over 90s, something like that, or if your blood pressure is only slightly elevated, we start talking about ways to modify your diet, ways to decrease the salt in your diet. I give people an opportunity to change their behaviors to bring that blood pressure down before starting medication. Now, I also ask people to be realistic with themselves. So, the same way that I ask my patients in the office to be realistic with themselves, I'm going to ask all of you to do the same thing. Be realistic with yourself. If you know that you're not going to stop eating all them potato chips, if you know that you are not going to stop the behaviors that led to your blood pressure being high, then you need to go on ahead and take that medicine. Why give all the pushback when you know you're not going to do what you should be doing? So, but if you know that you are going to, like, you're going to actually give it an effort and try to modify the behaviors and try to decrease the salt in your diet and try to exercise. If you are going to do it, then we give you a chance to do it and have you come back in and see where you are. Now, after a certain period of time, every doctor is different in terms of how much time they're willing to allow you to just try. But if you keep coming back in and every visit your blood pressure is elevated, guess what? We are going to be talking about medications. And I know a lot of people don't want to hear that because they keep saying, "Oh, doctors are pushing the medicines on us. It's a conspiracy." No, we're just trying to keep you here and living. That's all that is, okay? So the things that you can do in terms of modifying your diet and decreasing the salt in your diet, there's a lot of things in your diet that are high salt, and I went through those in a video if you want to check it out, the one previous to this. But it's basically, if you want to decrease the outside foods, so processed foods, so things that are already frozen and packaged quick meals, they tend to have a higher salt content, like canned soups, canned vegetables, things like that tend to have higher salt content. If you must do it, choose the low sodium option. But if you can avoid it altogether, decreasing processed foods is one way to go. Decreasing the amount of fast foods that you're eating also will help, because most fast foods will have a lot of salt. If you are going to go to a fast food chain, I'm not saying don't go, because everything in moderation, every once in a while, it should be fine. But check with your doctor. So if you are going to go to a fast food chain, make sure that you are choosing the lower sodium options off the menu. Most chains will have an option for that. So again, decrease in processed foods, decrease in fast foods, cooking foods yourself. Now, here's the trick about cooking foods yourself, because so I tend to do that, right? Because I want to keep my blood pressure lower. So what I do is I go ahead and I choose my seasonings carefully. And what I mean by that is I actually don't use overt salt, but most seasonings already include salt. So what you want to do is take a look at the salt content of the seasonings that you're choosing to use. And when you do that, um, you want to make sure that you're not adding excess salt to the food. Okay? I'm glad to know that we can cook food and have it taste good and be delicious. At least that's what my family tells me, right? But you can cook food, have it be delicious, and not load it with salt. I think because our palates are so accustomed to eating high salt food in this country that when it's not salty, people start complaining. But what you got to do is get your palate more used to eating foods with less salt. You have to get used to it. So over time, the more you do it, the more your body will recognize, wait a minute, I don't need all that salt. Wait a minute, I'm doing better without it. So I'm not saying don't have any salt in your diet. You wouldn't be able to function. Your body does need some level of salt to function. However, I want you to cut down the amount of salt that you're having, okay? The amount of salt that you're having. So when you're cooking your food, check your seasonings. If you have a seasoning that you're using that has a lower salt option, definitely go with that option. Now, one of the other things that I wanted to say, because for you people, now you know I have to talk to my Caribbean people for a second and my African people for a second. A lot of us like to use Maggi, right? And that's kind of like one of the standard seasonings that we use. Well, it's loaded with salt. So if you can look for the lower salt version, or if you must use it, use less than what you were using before. Because some of us, even though we are not going to fast food chains, even though we're not doing processed foods and we're cooking at home, all that food you cooking at home, if it's loaded with salt, you're not doing your family any kind of service. You really aren't. And you're not doing yourself any kind of service either. So I want to say, please be careful about how much salt you're eating. Now, let me check before I continue on what questions you guys have for me. And it looks like one of the questions here says, I'm pretty healthy, exercise, and do not have hypertension. So when you say you do not have hypertension, I just want to be clear. That means this person is saying they were not diagnosed by a doctor with having elevated blood pressure that is clinically classified as hypertension. Okay. So if your blood pressure goes high once, that's not considered hypertension. So this person is saying they're healthy, they exercise, they don't have hypertension. Can they eat as much salt as they want? The answer to that is no. No, don't you wish you could? No, because what will happen is that over time, even though you are healthy and exercising, over time, if you're doing too much salt, again, the same thing that happens even with the exercise, technically you're not eating healthy if you're eating as much salt as you want, because that's not considered a healthy diet. But over time it will cause your blood pressure to elevate. Now, one of the things, and I'm just going to briefly go into this because it's really, I think, one of the things that's kind of hard to explain without going into too much detail, but think of it like this. When you have too much sodium floating around in your body because you ate too much salt, it causes your blood vessels to constrict. What we call, it causes them to get smaller, narrow. So I'm going to use my hands as an example. So if you have, let's say, a vessel, right, that is this big. I'm trying to get it on both screens here. Give me a second. So if you have a vessel that's this big, and then you have a lot of salt and it goes to that much now, right? You see the hole got smaller, and you have the same volume of blood pumping through that hole. It's going to be much harder for it to go through. So what it's going to do is create a high pressure system. So the more you keep pushing salt, a lot of salt into your system, it's going to cause that high pressure to be there more consistently. And over time, that's just giving your heart so much more work to do. And you don't really want to do that, because at the end of the day, when you keep doing that, over time, your heart gets like, yo, I'm tired. I'm worn out. I can't take it no more. And your heart starts to fail. Okay. And I think that's one of the simplest ways that I can explain that. And I think if you guys want me to do live or a series on heart failure, please put that in the comments. I'll definitely consider doing that as one of the follow-ups in the coming months. But in essence, that's what can happen. So again, I would caution you against eating as much salt as you want. Again, as I mentioned earlier, all things in moderation, right? Eating everything of what you want. It's just like you, for those of us who have kids, you're not going to feed your kids ice cream all day, every day. They may want it all day, every day, but you would not do that to them, because you know that that's not sufficient for them in terms of vitamins, nutrients, and it will make them sick over time because too much of any one thing is not good, right? So that's what I would caution you against with that. So I'm going to go into the next thing, which is in terms of decreasing salt in your diet, is about food with visible salt crystals, which I feel like when I go into the supermarket now, that's what I see, right? Every once in a while, it's okay to have some nuts or potato chips or popcorn, pretzel, whatever your snack of choice is. As much as I don't want you guys to have too much, like I said, too much of any one thing, if you have a snack of choice every once in a blue moon, you want to have that snack, is fine. But again, try to choose snacks wisely. If you can see the salt crystals sitting on your food, that's too much salt, y'all. That's just too much salt. So what I tend to do, and when I do it, people look at me like I'm crazy, but I do it anyway. So there are two different things that I do when I see a lot of salt on my food. Like if I want, like my preferred, my go-to is like tortilla chips. I like tortilla chips, but and it's really hard to find non-salted tortilla chips. So if I can see salt crystals on it, usually I don't want it because I already know it's too salty. But I try to get the crystals off. Like I try to clean them off. So sometimes with things like pretzels, you can actually just pick them off and it's time it can be time consuming, which is why people look at me like I'm crazy sometimes doing it. But I don't ingest all that salt. I just don't. It's not good for me. I don't want it. I'm not going to do that to myself. The other option that sometimes what I do is I have like a napkin or I have like a I just wash it off in water. What I do something like that because I'm trying to get that salt off. And I do it, eat it quickly. It's still crispy and it's a whole lot less salt. And I'll tell you, after all the years for me decreasing the salt in my diet, after all the years of doing that, I would tell you my ability to pick up salt on food, it's like second to none. The my salt sensitivity scale, it's like right on target. If something is too salty, I'm going to let you know. So like I said, this goes back to what I was saying about your palate changing over time. Your palate changes and it becomes more accustomed to less salt in your diet. Now I got another question, so let me see. It says, how much, if I cut down on my salt intake, how much cutback is okay? Is it possible to have too low salt intake? And would this also be an issue? So, yes and no. So, it depends on what your starting point is. So, you want to know how much to cut back, but yeah, it really, I guess the best answer is it depends on your starting point. Because if you are starting off quite high, then um, you have more room for decrease, if that makes sense. So generally, you do not want to go over 1.5 grams of sodium. So if you look at the foods that you eat throughout the day, and I mean, just start paying attention and adding them up, you will get beyond that very quickly. Most average healthy exercising people who don't have any issues will what you will the recommendation is generally about 2 grams of sodium per day. um but I typically say try to cut it down to 1.5, which is a little bit stricter, but it goes a longer way in terms of how your body reacts to salt. So if you are have if you add up your salt intake for the day, or you kind of track it over a few days, and you realize, oh, you're taking in 3 grams of sodium per day, you're taking in 4 grams, 5 grams. If you're at 5 grams per day, then you know you got a long way to go. You got to cut it by more than half, right? To even get to the 2000 or the 2 grams that is recommended. So that's a lot of cutback. But if you are just at 2,500 or 3,000, then the amount that you have to cut back is less. So I hope that answered that question for you. But yes, you don't, it really depends on what your starting point is. And I think um, if you go ahead and check your salt intake per day, you will realize it's probably a lot more than what you thought it was. If you are someone that have a hard time like keeping track of the numbers, or you're like, oh, I don't have the time, I don't want to, whatever your rationale may be, what you can do is, instead of looking at the hard numbers, just be mindful. Like, let's say that you're someone that was eating fast food, because I know people who do it. They eat fast food for breakfast, lunch, and dinner. And I'm not criticizing, I'm not judging, I'm just saying there are people who do that. And if that is your situation, let's, instead of saying, oh, this is the exact amount of salt that I'm eating per day, what you can do is you can just cut one of those per day. Instead of doing it for breakfast, lunch, and dinner, maybe cut it out for dinner. You can do breakfast and lunch for a while and do your dinner at home and do a home cooked dinner. And then when you get comfortable with that, then cut it down to, instead of breakfast and lunch, just doing lunch. So there are other ways that you can try to decrease it that doesn't require you to look at the exact numbers every time. Because I assure you, again, based on the American diet, you're unlikely to cut your sodium to the point where it's so low unless you are doing some form of extreme dieting. So I wouldn't necessarily worry about that. And my recommendation to those of you who are thinking about doing that is, this is where having a primary care doctor comes in handy. You need to go see your primary care doctor and have a conversation about this and how you move forward. A lot of times, especially if you're having issues, your doctor can recommend a dietitian. And a dietitian usually is happy to go over with you what kinds of things you can eat versus what kinds of things you shouldn't, in order to help to improve your health. Because many times people who have high blood pressure or are diagnosed with hypertension, they will have other medical issues going on in addition to hypertension. So in essence, if you're seeing a dietitian, they can really help you to hone in on the things that you need to do, to cut back. Okay. I hope that answered that question. So I want you guys to do the things that I've mentioned before as best as you can. But the next category of things that I wanted to get into is having like cured or canned meat. So like cold cuts tend to be quite high in salt. Like ham, bacon, sausage, those type of things tend to be high in salt, and hot dogs, things like that. So cured meats. Um, Again, if you can, opt for the lower sodium option. That really is your best bet. Opt for the lower sodium options if you're going to have these things, because that will go a long way in terms of helping you with your health. Now, the other things that sometimes can be quite high in salt is some of the condiments we use, and we don't think about it. But a lot of us like, oh, you want to get French fries, and you're going to also get all these sauces to go with the French fries. So a lot of places, like again, fast food places, you get French fries, they have salt on it because you could see the salt crystals, like I was mentioning before. But then you're going to get a sauce, and the sauce also have quite a bit of salt. So just be careful with those things, okay? And when you go to get your French fries, just ask that they don't put any salt on it. They will prepare it that way. That is something that you can do, to help to decrease the amount of salt in your diet. So that was a lot Do you guys have any additional questions, or what questions can I answer for you regarding any of these things? I'm here, happy to answer your questions. If you have any that you're not able to post in the chat, or in the comment section, please go ahead and send me a DM on either Facebook or on Instagram or on TikTok, and all of those are at Amize Health. So I will be happy to answer any additional questions that you guys have. I'm just going to go ahead and check all of these now, just to make sure that we've covered things that we need to cover. So one of the things, while I'm doing these checks, one of the things that I wanted to mention also for you guys is, how are you finding out how much salt is in your food? Or if you're checking, how do you check? So on each label, on each food label, there's going to be a breakdown of the contents of the food. Excuse me. And generally, that's where you would see the sodium content. So what you want to do is read the label to make sure. So salt or sodium is what you're looking for. Generally, on the package label, you'll see sodium, and then they will put how much sodium is in that thing per serving. So for instance, if you have the easiest thing I can think of is chips still. If you have a bag of potato chips, generally if it is a small bag, it'll say there is one serving. So however much salt is in that, that's what's in the entire bag. But if you get a double size bag or something bigger, you're going to have multiple servings in that bag. So whatever the salt content is, it's that times the amount of servings that's in the bag. So what you want to do is, like I said, aim for the lower sodium options. Those foods will tend to have 140 milligrams or less per serving. If you see anything that has 500 milligrams or more per serving, that is way too much salt. Try to avoid those, okay? Now, if you go to the seasoning section, some seasonings will have 600 milligrams per serving, things like that. So because it's concentrated, right? So with that, you think about how much food it is you're making. So when you're cooking your food, if you were to put 600 milligrams, so one serving of that seasoning into your food, if you were to do that, then if you're not eating that entire thing in one sitting, then you have more than one serving. That 600 milligrams is distributed across everything that you're making. So it doesn't necessarily apply quite the same way when we're talking about seasonings, but with chips, prepackaged meals, things like that, a lot of like canned soups and things, they will have quite a bit of sodium. So really look for the lower sodium option. Because even when you look for the lower sodium option, I want to say be cautious. Just go ahead and take a quick peek at that sodium content, because sometimes they will say reduced sodium or low sodium, but the actual content or amount of sodium is still quite high. So just take a look at it to make sure. Now, if you need specific guidelines about how much salt or how much sodium you need to be taking in, you really need to talk to your doctor, because when I'm on this platform giving you suggestions and things like that, that's all they are. This does not take the place of you seeing your doctor. And part of that is, and I try to explain this to people all the time, when you see someone online talking about something, they do not know your personal medical history. So the things that we're saying is generalized, right? But they're not individualized. Seeing your doctor will get you individualized care, and that's what you need. So I'm given these as generalized principles to follow, but what is going on in your specific case may be that you need more salt than what I'm saying, or maybe you need a stricter you need to follow a stricter guideline than what I'm saying. But there's no way for me to know that because I'm making generalized comments and you need individualized care. So that is the part of the importance of seeing your primary care doctor in order to get that figured out. So the that's all the things that I've been saying about diet. So let me go ahead and check. So, huh, additional questions that I have right now are: does the source of my salt intake play a role in salt retention? For example, fermented foods versus processed foods versus seasoning. I don't have a really good answer for that. What I'm going to say is, as long as you are taking in too much salt is going to lead to water retention. It doesn't matter what you ate to cause you to have that much salt. You could have ate the salt from the salt container. You could have had it from, just like you said, fermented foods or processed foods or seasonings. You now have that sodium in your body. Too much of that is going to cause water retention. Or excuse me, you put salt retention, but it actually leads to water retention. So sometimes some people are like, I don't know why my feet are swollen. I don't know why my ankles are swollen. Oh, sometimes it's just from standing too long or sitting too long. But sometimes if you pay attention to what you ate, that might be the culprit why you haven't swelling in your legs. So that water retention can be because the water is following the salt. It's like, oh, you got some salt in here. I need to come because, again, this is one of those things trying to explain. It's like the the level of sodium um, in the blood wants to be at a certain level. So when the salt is too high, the water follows in order to try to balance it out, and now you're retaining water. Um, I'm gonna try to find some easier ways of explaining some of these concepts to you guys so that you can really get it. But basically the main thing is, you don't, regardless of if it's fermented food, to answer your question, or processed food or seasoning, regardless of where it's coming from, you just want to be cautious about having too much salt in your diet. Okay, we spent a lot of time talking about diet, right? And appropriately so, because that's a big part of where you're getting you're getting all the salt, and that's causing high blood pressure. But the other things that I had mentioned before were about physical inactivity. So if you're not exercising in any way, then guess what? You need to exercise. You need to increase your activity level, because increased activity or physical exercise has actually been shown to help to decrease your blood pressure. And I wanted to mention, so if you are someone that is overweight or obese and you lose weight, this losing weight can lower your blood pressure. I'm sure some of you have heard people say, oh, I had high blood pressure. My doctor diagnosed me with high blood pressure, but I lost some weight and I don't have it no more, right? Sometimes they say that about diabetes too. We'll talk about that next month. But if you lose 20 pounds, it's been shown that you can potentially drop your blood pressure by 5 to 20 points by losing 20 pounds. Now, the other recommendations is following like the DASH diet. I tell my patients about that all the time. You want to eat a lower fat diet, increase your fruits and vegetables. Low fat dairy could help to reduce your blood pressure also. And then you want to get daily exercise. So the American Heart Association recommends 30 minutes of exercise at least 5 days out of the week can help to reduce your blood pressure. So that's walking, as simple as walking. You can do 30 minutes of walking, but during that walk, if you're able to carry out a conversation, you're not doing enough, because generally you want to walk to the point where you're at least raising your heart rate a bit. So if you just chatting away on the phone, you're probably not getting enough in. Okay, so 30 minutes of exercise 5 days out of the week, so 150 minutes per week. Or if you do more rigorous exercise, at least 75 minutes per week. And then limiting alcohol consumption. Men should have no more than 2 drinks per day, and women stick to 1 drink per day. Okay, not something a lot of people want to hear, but it's part of the recommendations to lower your blood pressure. So these are all the different things that we can do. We just went through quite a number of them. Okay. And then, like I mentioned when I started off, was decrease in stress. Not easy to do, but we can do it. So I'm gonna do another check to see if there's any additional questions as we begin to wrap up. So I hope that having this conversation on high blood pressure has been helpful. If you have any specific additional questions that you want to ask, feel free to drop it in the comments, or basically to send me a DM. Also, remember that I am available to be booked for speaking engagements. If you want to send a request for that, you can send me a DM or go to the website www.amizehealth.com and request for a booking there. And we will continue this year. The goal is to go through different disease processes and talk about them, and talk about things that we can do. A lot of times, many of us don't want to take medication. So this is before it gets to the point of needing to be on medicine. Sometimes if that's where you are and you need to take medication, don't be ashamed of it. Do what you got to do to stay healthy and stay here and stay well. Okay. So before we hop off, I see another question came in. It says, thanks. So drinking more water does not help after eating salty foods. Not necessarily, because you likely would retain that water, as I was mentioning earlier. Or, you'll go more frequently, but there's still some water retention. And if you're saying help with your blood pressure, it does not. It's the sodium load to your body still causes the vessels to constrict. So even if you chase it with water, it still causes some level of constriction. Now, if you are someone, again, that's healthy and your vessels are healthy and you're young, your autonomic nervous system will kick in to help you with that. But as you get older, as you get older, or as you have other illnesses that can potentially contribute to how your body is regulating your salt water balance, that likely would change. So I would tell you that drinking more water is not the solution. Decreasing your salt would be a better solution. Okay. So thank you guys for joining. Thank you for all the questions that came in tonight. I was hoping to see someone that had a question, and I just needed a further clarification on a question that you sent me in. So hope that you guys can join me next time. Like I said, next month, I'm hoping to get into a discussion about diabetes. And that's something that plagues the Black community. So I think that would be a good conversation to have. So should you have any questions, definitely send them my way. I will be dropping a new video every Monday. And again, these Q&As are on the fourth Monday of each month at 8 p.m. So join me. I'm going to try to keep going with the YouTube Live and Facebook Live. Should you have any questions or comments, please feel free to send them. Thank you for joining me tonight. I'm Dr. Thorpe with Amize Health. You guys stay well, stay blessed, take care of yourselves, and try to decrease your blood pressure. Okay? Have a good night. It was good chatting with you.